My name is Tanuja Damani, and I'm the Surgical Director of the Center for Esophageal Health at NYU Langone. My passion is minimally invasive surgery or robotic surgery, where I feel that we can really treat these complex conditions with tiny incisions and get patients home the same day or the next day with less pain and faster recovery. So at the Center for Esophageal Health, the diagnoses that we most routinely see and treat are conditions like reflux, or what's commonly known as GERD, motility and swallowing disorders of the esophagus, and hiatal and paraesophageal hernias, where the stomach is sliding up in the chest and either exacerbating the reflux or causing much more difficulty with eating for patients. So I think of the robot as a tool that is in the armamentarium of surgeon, a tool that allows us to do surgery with enhanced magnification, dexterity, and precision, especially in the chest area, which is where we spend the time as foregut surgeons. There are a lot of critical structures in this area, including the heart, the lungs, some big blood vessels, and the robotic surgery allows us to really do that with the kind of magnification and the dexterity that's really necessary to do this kind of fine surgery. I've embraced robotic surgery now for close to a decade, and I cannot think of any other way that I think I would do minimally invasive surgery in this space. So when patients come to NYU, we don't treat them as a diagnosis. There's a very personalized approach. Every patient is unique. We listen to the patients, listen to their symptoms, understand really what is going to be the best workup and testing that's appropriate for them, and get our team of experts involved based on that. Some patients will do just well with medical therapy, but we also have more advanced therapeutic options for those patients for treatment, including both endoscopy and certain anti-reflux procedures that we provide endoscopically and robotically. So in our minds, what we are looking at is really putting all that information and testing together as a team. I think most of the places that we see where this kind of care is provided, it's in silos where there is not a lot of communication between the groups. And I think what we excel at is really providing that care seamlessly across multiple specialties and really having that communication where we will call or email each other all the time to figure out what is the best option for this patient. Often patients who have had these surgeries in the past and have developed either a recurrence of the hiatal hernia or failed anti-reflux surgery don't realize that there are options for revision for these procedures. And this is one of the things that is our expertise, where we will go in robotically to revise these operations and in a minimally invasive manner and get these patients home the very next day. And I think this is something that is really important for providers and patients to understand, that we can do complex revisional surgery very well in a minimally invasive approach.